today is about guidelines on patient counselling, and this was a requested topic, so I just had to do it. Sorry about the rain, I think you can hear it, it's raining out here. So this is about patient counselling. It's to check if the patient is getting the desired outcome or not, the therapeutic response that we want him to get. So what you're going to do is you can't just leave your patient to rot even if you hate the job or if you hate him. You have to counsel him, you have to educate him on the name and the class of the drug. Even if you don't know where, you can just check it and tell him. And then we have to tell him how to use the drug, the directions how to use it, and the storage conditions and how he's going to store the drug, and the drug-drug interactions, the food-drug interactions. And then most important thing is you have to tell them about the reason of why the patient is taking the drug, and you have to tell them about the side effects. So if they are experiencing any side effects, they can identify it. And then you have to teach the patient on how to monitor the therapeutic response he's getting, and if the patient isn't getting the therapeutic response, how to react to it. Should he come to you or go to the physician, or whatever he has to do? You have to counsel the patient on everything like that. Now the question is, who are you going to counsel? You can't really counsel each and everyone, so what you're going to do is, in that condition, you're going to counsel the patients that you have to counsel. That's more important. So they are the patients that are using more than one drug. You have to counsel them because then the interactions are involved and lots of things are involved. And the patients who have a hearing problem, or who have a visual problem, or who have literacy problems, right? And then if there are children involved, if it's pediatrics, then you have to counsel them. And patients especially who are on anticoagulants, you have to counsel them. And yeah, who have new prescriptions, of course you have to tell them like what changed in the prescription and why did it change, and you have to counsel them on the new interactions, or if there are any interactions, or how to take the drug, right? And what else you can do is, what you have to do, and you should do it, you have to check why, if there are early refills, why are the early refills, or why are the late refills? Why is the patient asking for more drugs, or why is he just getting it delayed, right? Now the format of counselling, it should be verbal and then it should be written, right? Like first you're just going to tell them, because at that time the patient can be really stressed out, or to be honest, who wants to listen to anyone? We were in class and we didn't want to listen to anyone. We didn't even want to listen to our teachers, so we just read notes. So in the same way, it's going to be like, first you're going to tell them verbally, and then you're going to give them a written one, all the directions on it, right? Now about the counselling area, like we don't like to sometimes like talk in front of everyone, saying patient can feel the same way. It should be private or semi-private, so there are no distractions and the patient shouldn't feel uncomfortable or anything. You can counsel them in a good way. And about documentation, is all the counselling session, it should be documented, and if the patient doesn't want to be counselled, you have to document that as well. So, and this was all about prescription drugs. Now non-prescription drugs, that like OTC drugs, like the patients just take themselves, what you have to do is you have to do a little mini assessment on them as well. What you're going to do is you're going to ask about the current medical conditions. You're going to ask about the other drugs that is taking, even if they're herbal, because anything can interact. You have to ask about the allergies, because the patient can be allergic to anyone. Yeah, they can be allergic to anything, even anyone. You can't really do anything about that. But if the patient is allergic to any substance, you can change that, or you can guide him on that. And you should ask the patient if he's consulted any healthcare professional or not. And what you're going to do, the whole reason of doing this, is you can refer the patient if this condition is really severe, if he has a wrong self-diagnosis, or if he's uncertain about the symptoms, and if other risk factors are involved. Now in the end, what you should have told the patients is how long they are going to take the medicines, yeah, and how they are going to take the medicines, if they're going to take it with water or juice, or how they're going to take it. Obviously it's water, don't tell them to take it with juice. And if the patient has missed a dose, you're going to guide them on that, and if there are special precautions involved, and which food they should avoid or which drinks they should avoid, the patient should know all of this. Now this was the patients that are counselled irregularly, or they can be counseled. Now there are certain patients who have to be counseled on certain intervals, right, again and again after some time, and they get annoying too maybe, but never mind that, you still have to do your job. They're going to be asthmatic patients, they're going to be diabetics, they're going to be patients who are taking more than 4 drugs, they're going to be patients that are mentally ill, that are properly mentally ill, not the people you're annoyed from who are actually mentally ill. Epileptic patients, patients with skin complaints and misusing drugs who are doing that, and patients who are terminally ill. Now, in the end of the day, the summary is what you should have is you should have an improved understanding about the patient and the condition of the patient, and the patient trust you more, and you should give him the attention that he wants, even if it's attention seeking. And you should have a job satisfaction that you're only going to get when you get paid, but still you should be satisfied by your job, jokes aside. And you should have a better relationship with the physician and the patient. So that was all about counselling, and that's it. Do drop a like and do subscribe to Pharmacy Fun. This was fun.